A presentation on Patrick's case study by Alexandra Weavers and Robin Grieve. Patrick's health is impacted by a number of health problems. His medical history and lifestyle choices contribute to his declining health status. Patrick's respiratory system in particular is under a great amount of stress and is evident by concerning symptoms. He has a chronic cough and suffers from dyspnea. Dyspnea is a subjective symptom relating to difficulty breathing, often described as breathlessness or laboured breathing. The most common causes of dyspnea result from heart failure and chronic obstructive pulmonary disease, two health disorders that Patrick suffers from. COPD presents a persistent cough and presence of thick mucus. His heart failure causes a buildup of fluid from the left ventricle which eventually backs up into the lungs, making breathing more laboured and as a result worsening his COPD. Patrick was a smoker for the majority of his life, which led on to the development of emphysema, which largely contributes to his respiratory symptoms. Over time, epithelial cells are placed under immense stress from chronic irritation caused by cigarette smoke that squamous metaplasia occurs. Specifically, this is known as epithelial alteration of the tracheobronchial mucosa, which is where bronchioli epithelium is replaced with squamous epithelium. The change in cell structure decreases the elasticity of the lungs. This in turn makes it difficult to produce a solid cough to bring up any unwanted content such as excess mucus in the lungs. During Patrick's myocardial infarction, the blood supply to the left side of his heart was blocked, resulting in ischemia. Continued impaired blood supply to the heart led to necrosis of the tissue and the formation of collagen scar. The damage of Patrick's heart is irreversible, and now the heart is trying to compensate for the damaged tissue and congestion, causing dilation of the ventricles. COPD and congested heart failure and low hemoglobin prevents Patrick from receiving adequate oxygen. Low oxygen is detected by the peripheral chemoreceptors, stimulating the sympathetic nervous system to release epinephrine into circulation. Epinephrine attaches to the beta-1 receptors on the heart, consequently increasing heart rate and contractility. An increase in sodium and potassium directly relates to Patrick's increased heart rate. The heart is regulated by three ions: sodium, calcium, and potassium. Sodium influx occurs at the contraction of ventricles, thus an increase in sodium will decrease time taken for depolarization during the contraction of the heart. While potassium influx occurs at the relaxation of the ventricles, the repolarization of the heart can be shortened from increased potassium. Thus, Patrick's shortened ventricular contraction and relaxation can directly increase heart rate. Patrick's BMI was calculated to be 29.3, which indicates that he is on the verge of becoming obese. This excess weight carried on his body increases the workload for the muscles, which consequently require more oxygen for efficient ATP production. This also results in the stimulation of the sympathetic nervous system, as explained before. Although if Patrick has become leptin-resistant and no longer producing leptin, nitric oxide production is not stimulated by leptin, resulting in vasoconstriction, thus increasing workload again. Patrick is diagnosed with COPD and has a history of left-sided heart failure. Both of these conditions developed independently but have a clear effect on each other. Chronic obstructive pulmonary disease is a progressive inflammatory disease that causes obstructed airflow from the lungs. Emphysema and chronic bronchitis are the two most contributing factors to the onset of COPD. Emphysema is caused by long-term exposure to cigarette smoke, which results in loss of lung elasticity, permanent enlarged air spaces in bronchioles, and damage to alveoli walls. Damage to bronchioles reduce structural support for alveoli and small airways, making them prone to collapse on expiration, which leads to gas trapping. Ultimately, this leads to decreased lung compliance, increasing effort into breathing, and dyspnea. Chronic bronchitis is an inflammation and mucus production in bronchial tubes and is also developed from long-term smoking. Overproduction of mucus in response to inflammatory causes excess mucus buildup in the bronchi and airflow obstruction. This results in a chronic cough that brings up a thick discolored mucus as well as chest pain and shortness of breath. Left-sided heart failure occurs when the left ventricle of the heart doesn't pump efficiently and in turn deprives the body of oxygen-rich blood. The heart is overworked in trying to provide the body with enough blood. Over time, this causes blood to build up in the left atrium of the heart and eventually backs up in the lungs, leading to fluid congestion. Common causes include smoking, high blood pressure, cardiomyopathy, obesity, and atherosclerosis. There is an evident relationship between COPD and left-sided heart failure, in which both conditions worsen each other. When blood is poorly oxygenated due to COPD, extra stress is placed on the heart, worsening the symptoms of left-sided heart failure. The excess fluid in the lungs caused by left-sided heart failure makes breathing more difficult in patients with COPD and will therefore worsen respiratory symptoms. Patrick's history of left-sided heart failure puts him at high risk for right-sided heart failure. Right-sided heart failure occurs when the right ventricle of the heart isn't performing adequately through pulmonary circulation and is usually triggered by left-sided heart failure. When the left ventricle fails, the right ventricle has difficulty transferring deoxygenated blood back into the lungs for reoxygenation. When there is a buildup of blood in the left ventricle due to left-sided heart failure, it then pools in the left atrium, backs up into the lungs, which increase blood pressure in the pulmonary vein connecting to the right atrium, weakening the right side of the heart and finally causing right-sided heart failure. Ultimately, this allows for blood to pool up in farther extremities such as bodies, veins, causing swelling and congestion. A common predictor of right-sided heart failure is fluid retention in the legs causing swelling. Patrick is showing swelling in his lower legs, suggesting right-sided heart failure. Congestive heart failure causes blood to pool, leading to a decrease in cardiac output and edema in the extremities, lowering blood volume. By lowering blood volume, sodium, potassium, iron concentration increases. A decrease in cardiac pressure is directly related to decrease in glomerular filtration rate. According to Patrick's blood test results, excess sodium and potassium are not being filtered into the urine. This is due to a decrease in cardiac output and lowered filtration rate. The kidneys are impaired and unable to produce hormones, renin, insulin, erythropoietin as GFR decreases. Insulin is an essential hormone produced by the pancreas that stimulates uptake of glucose into cells. Patrick's waist circumference and lipid levels indicate he has metabolic syndrome where leptin resistance occurs and the brain no longer detects leptin due to regular elevated levels. Thus, high levels of leptin is detected at the pancreas lowering glucose, induced insulin production. Patrick's insulin levels are low, resulting in increased BGLs. Glucose also attaches to hemoglobin, impairing the release of oxygen to cells essential for effective ATP production. Due to Patrick's congestive heart failure, COPD, and glycated hemoglobin, it is likely that Patrick's cells are being deprived of oxygen. Oxygen is essential for producing efficient ATP that is required for sodium-potassium pump for regulation of cellular potassium and blood sodium. The pump removes sodium from cells and replaces them with potassium while converting ATP to ADP. In Patrick's case, sodium and potassium are accumulating in the blood. This increases neurons to become depolarized. Now, stimulus that will normally be sub-threshold in Patrick's neurons could now meet the threshold for action potentials and consequently cause the neurons to fire. The kidneys are responsible for the activation of vitamin D into calcitriol, which is an essential hormone for the regulation of calcium in the blood. Calcitriol increases absorption of calcium from the gastrointestinal tract and reabsorption in the kidneys. Calcitriol also stimulates the release of calcium from bones by stimulating the release of rank L protein in osteoblasts, converting them into osteoclasts. Osteoclasts then break down calcium in the bone to maintain blood calcium levels. In Patrick's case, his kidneys are unable to produce calcitriol due to impairment. Low calcium levels also lower the action potential threshold, making Patrick's neurons even more sensitive. Low calcium continues to activate parathyroid hormone production, attempting to regulate calcium levels. Patrick's kidneys are also unable to produce erythropoietin, which is essential for the production of red blood cells. In Patrick's body, his kidneys are ineffective at producing erythropoietin, leading to a decrease in red blood cells and consequently hemoglobin, which are both essential for transporting oxygen to tissues. Patrick's left-sided heart failure is causing congestion. This is where blood pools up and starts causing an increase in ventricular pressure. An increase in ventricular pressure stimulates the release of BNP, brain natriuretic peptide. BNP causes vasodilation in coronary arteries, allowing for a decrease in pressure on exertion. BNP also increases the excretion of sodium and water by inhibiting RAS, to consequently lower blood pressure from blood volume and slow the heart rate. Patrick's BNP levels are likely to be elevated during his worsening left-sided heart, as his ventricular pressure is high, although Patrick's urine volume is likely to be low due to low glomerular filtration rate from his low cardiac output.